Good afternoon. I hope that you still have some energy to listen to my presentation. I will move more quickly about it. So please. Yes. Yes, according to summit agenda that our topic is today for sustainable development goals. Maybe some of you, they don't have much idea about the goals. So in 2015, United Nations adopted some goals to put end for poverty and protect the planet and ensure that by 2030 all people enjoy peace and prosperity. For this purpose, 17 goals are integrated in the way that one area will affect outcome in the other. So the 17 goals, including no poverty, zero hunger, good health and well-being, quality education, gender equality, clean water and sanitation, reduce inequality, climate action, life below water, life online, all these 17 goals, but I'm focusing today on the third one, which is the health. Good health and well-being. So good health is essential to sustainable development. For that, United Nations Development Program prepare a plan for 2030 that including some targets, take in consideration widening economic and social inequality, rapid urbanization, threat of the climate and environment, continuing burden of HIV, other infectious disease, emerging challenges such as non-communicable disease. All this take in consideration and the targets are prepared. But still, the world is off track to achieve the health-related SDGs. Here we are, the current situation. Every 2 seconds, someone aged between 30 to 70 years die prematurely from the non-communicable disease, cardiovascular, chronic respiratory, diabetes, or cancer. 7 million people die every year from the exposure to particles in polluted air. 1 in 3, more than 1 of every 3 women have experienced either physical or sexual violence at some point in their life, resulting in both short and long-term consequences for their physical, mental, and sexual reproductive health. 40 million at least people have no basic health care, and 40% lack social protection. 1.6 billion people live in a fragile setting where protracted crisis combined with weak nation capacity to deliver basic health services present a significant challenge to global health. 15 million by the end of 2017 people living with HIV were receiving antiretroviral therapy, yet more than 15 million people are still waiting for the treatment. Here are some goal targets. By 2030, reduce the global maternity ratio in less than 70% per 100,000 live births, and the epidemic of AIDS, tuberculosis, malaria, neglected tropical diseases, hepatitis, waterborne disease, other communicable disease. Reduce by 1/3 premature mortality from non-communicable disease through prevention and treatment, and promote mental health and well-being. Sorry, I move quickly because of time. Achieve universal health coverage, including financial risk, protection, access to quality, essential healthcare services, and access to the safe, effective, quality, affordable, essential medicine and vaccine for all. These some articles published by UNDP regarding the mentioned targets. What UNDP doing in Iraq, as you know, the Iraq passed through very complicated situation in the past few years. ISIS invasion, and some area affecting providing the health services. For that reason, United Nations Development Program signed an agreement with the Iraqi government to support the liberated area in 5 governorates to renovate the infrastructure and mainly the services. They focus on services sector. One of them is the health sector, that include renovation of infrastructure, supply medical equipment, supply of medical furniture, office furniture, and other like electrical generators. Until now, from 2015 until today, 437 completed project, 259 project under implementation. But during the COVID crisis, we got a request from the Iraqi government, and mainly from the Ministry of Health in Kurdistan and in Baghdad. They requested UNDP support. By that, the resident representative of UNDP conducted many meetings with the minister and with the colleagues in WHO and other UN agencies. And they put a plan how they can respond to this crisis. And they put the responsibility of strengthening the available health facility on the shoulder of UNDP. According to that, we work in 17 governorates, except Baghdad, and there are 19 isolation wards constructed or rehabilitated that increase the bed capacity in 376 beds. In addition, to improve access to a laboratory by supporting with the PCR machines for 3 centers. In addition to provide the PPE medical equipment, including the ventilators. So here, that 15 is completed for under implementation and 376 our target. These are areas where UNDP work: Anbar, Salah ad-Din, Dayal, Najaf, Karbala, Ninawa, Kirkuk, Dahuk. Thank you. ذيقار, بابل, ميسان, ديوانية, مثنى, واصل, سليمانية, and Erbil. For the ventilator, 180 were delivered, 120 under distribution, and 60 under procurement. And this is the number of the patient monitor, sucker, and defibrillator, other equipment, ECMO and glidoscope, laryngeoscope, and medical furniture. You can have a look on it later on. And this for PCR provided to Anbar, Duhok, and Erbil Central Lab. This is the number of the PPE will provide and will provide later on. And here, the Duhok COVID Center. So you can have a look this for 40 seconds. This ward, the bed capacity is 20 bed and provided, built as isolated room. Each room have 1 bed and 1 ventilator. Also provided with the oxygen generator to provide central oxygen to the ward. That's all, and thank you. Thank you. Any question, please?
Greetings. My name is Sahand. I am from IFMSA Kurdistan, which is an organization led by medical students. Thank you for your presentation. I had one question. How are the SDGs prioritized? Which one goes before which? Because I saw in your presentation and in your seminar that some goals got more attention than others, and thank you.
Thank you so much for this is a very important question. Yes, as I mentioned that all the situation in Iraq is complicated. So the priority is put it according to the situation and assessment that done by Ministry of Health. ISIS invasion, we are not far away from the SDGs, but we got the request from Ministry of Health to support that. But kind of support we provided to the liberated area even during the COVID crisis is not far away from to achieve the target. Here we increase the strength of availability, increase the bed capacity, there are many hospitals rehabilitated, many hospitals built, some health center also rehabilitated and built. For that reason, we reached to the point that we are happy what we provided, because now the people have health facilities and get health services. For sure, we are not achieving the target. What we need now is to do another assessment with the Ministry of Health in Kurdistan and also in Baghdad. And we see for the future planning and how we can match this plan with the future needs. Thank you. Yes.
Hello. Thank you, Dr. Wissam. Your topic is entitled The Sustainable Developmental Goals in Kurdistan for 2030.
Yes.
Are these goals different from the globally established goals, and have had these goals set up for Kurdistan, and who is doing this? Because you only mention only one of them, one of the goals. Thank you very much.
Yeah.
My name is Dr. Rajan. I'm the Dean of Nursing College, Suleimani University.
Thank you, Doctor. As I mentioned, that we already put the plan for that, but we couldn't achieve the targets because the whole situation in Iraq, mainly the economic situation is so poor at the moment, for many reasons you know about it. For that reason, I can't say we are away to work on these goals, but we put the priorities. Now, there is a good control for the COVID. Most of the liberated area, now they have good health services, many hospitals, rehabilitated health centers. And what we need now to work on it again with the Ministry of Health in Kurdistan, as I mentioned previously, to put the plan. I start work on that in February. We had met the High Excellency, the Minister of Health, and he asked UNDP support for that. I have many meetings with the planning department, but what I see this department still needs support, not only for the UNDP, other UN agencies and NGO concerned about health. We should work together. Maybe I get benefit of this conference to talk about this point. We need all together work with the planning department and decide what the Kurdistan region needed to improve the health situation, to provide better health services. Colleagues previously, they talk about the cancer. There is no PET scan, and they need to go to a private hospital or outside the country. They should put priority for that. Electronic system, still the public hospital using manually. There is no data, and we are far away from many countries, like Jordan just beside us. You can go to any public hospital. The patient can have all the information. They have also health insurance system. So this is very important to work on that with the Ministry of Health, and I will continue, have a meeting with them until we reach to put this plan, and we will see how UNDP can support on that. Thank you.
Okay, thank you very much. I'm Dr. Kanar, Director General of Cooperation and Coordination at the Ministry of Planning. Is it okay if I give that in Kurdish then? Because it's just for the public, just to give a clarification. أم حفظ قولي SDG كان للآن وزارتي بلانو نظام أبيستري للآن وزارتي بلان دانانەوە سەرپەرشتیەکرێ بە یارمەتی UNDP بێگومان پێشتر 2 ساڵەمە و پێش کاری لەسەر کرا بەڵام لەبەر مەوزوعی کۆرۆنا و ئەو کەرەنتینانە نەتوانراوە بەردەوام بێ ئێستا دووبارە ئەکرێتەوە بەڵام بێگومان لە ئاستی خزمەتگوزاری هەیە و لە ئاستی چاکسازی هەیە بە پێی بڵین ئەجێندای حکوومەت و کابینەی نۆ لەبەرەوە بەپێی خزمەتگوزاری 5 گۆڵ هەیە لەو 5 گۆڵەی کە پرایۆرەتی دراوە پێیان لەو هەفتەیە یەکێکیان بێگومان سەحەیە وەکو بواری تەندروستی بۆیە یعنی مەجموعەیەکن بەڵام تەندروستی یەکێکە لەو گۆڵانەی کە لە هەردوو مەجال ئەبێ پرایۆرەتی بدرێت پێی سپاس.
Can you translate?
Oh, no. Okay, then. Yes, as I said, I am working at the Ministry of Planning. Of course, we are supervising the SDG programs with the help and support of UNDP. We are going to start within 2 weeks again with the participation of all ministries and other institutions within our government. And as I have mentioned, with the program of our cabinet, 9th cabinet, we have prioritized 5 goals as the first goals, and one of them is health, of course, and that's why we, if there is the program of health will be, in combination with the Ministry of Health, work with it. So, as general, we are going to work on the different goals, and of course, without the goal number 17, we cannot achieve any of them, which is cooperation.
Thank you. We are ready for support. That's all. Okay. Thank you so much.